Hey friends, I'm Dr. Molly Brinkman. I'm a small animal veterinarian near Nashville, Tennessee. And this is a podcast for people who like to laugh, love their pets, and realize that life is hard, but dogs and cats help. I love veterinary medicine. I'm probably already obsessed with your pet, and I want you to understand more about both of those things. So welcome to the Dr. Molly Says podcast. Hello, friends. Hope everybody's having a good week. It is Monday morning right now. We are recording before work. I have a very random episode for you guys today. I wanted to just do an episode where I talked about a couple relevant things that I've seen lately, a couple interesting cases. So we're going to just get right into it. But first, I do have a hot take. So a few episodes ago, we talked about flea and tick and heartworm and intestinal parasite preventatives for dogs and cats. And so if you haven't listened to that episode, go listen to it if this is interesting to you. But my hot take, I didn't really think about what I'm titling my hot take. I guess my hot take is if veterinarians saw that there was a problem with side effects, serious side effects in a medication, they would be talking about it. And I say that with reference to preventatives. So the reason I'm saying this is I had a follower message me this week, kind of an aggressive message about how, because I had posted a story about someone died from the plague in the Western United States. And the post I shared was from Dr. Emily King, a friend of mine, and she just was saying how flea prevention is so important because that's how the plague is spread. But someone messaged me kind of aggressively, it felt like, saying that veterinarians need to come up with better, safer options for flea and tick prevention because the medications that we're recommending are killing all these patients. And we need to come up with better options. And, that really just burned my biscuits. I did not appreciate that message because if we saw that those medications were really dangerous and causing these huge problems and killing our patients, then we would be talking about that and we wouldn't be using them. And this person told me that the data shows that more pets die because of flea and tick preventatives than the actual diseases that they protect against. And that is just not true. And this is the danger of this phenomenon that's happening right now where everybody and their brother thinks they have a valid opinion about medicine and science. And the fact of the matter is not everybody does know about all of those things. And just because you've read something on the internet, and this person later admitted to me or said to me in the DMs that the data she's talking about, she got from Google. That is not data. So that's not true. There's no data at all. There is no data that shows that pets are dying from flea and tick preventions and this is this big problem and that there's any significant numbers of that happening. Side effects happen from all medications that anybody gives, human, animal, whoever. And so they're rare, these medications. I've already talked about this in a podcast, but go listen to the preventative podcast. I also talked about seizures. So go listen. But anyway, if veterinarians knew that this was a problem, we would be talking about it. Okay, I'm going to move on. See, it got me all Enneagram 8 annoyed. Okay. Today, we're going to talk about 3 very random things, the 3 most random things you never thought you wanted to hear about. Here we are. Welcome to the Dr. Molly Says podcast. I'm going to give you a menu we're going to talk about. Maybe this will intrigue you and keep you here for the next 30 minutes. We're going to talk about vestibular syndrome in dogs. Cats can do it too, but we're going to mostly talk about it in dogs because it's a dog thing. We're going to talk about a very, very interesting cat case I saw last week. And then we're going to talk about vulvas. One of my favorite things to talk about if you follow me on the internet. All right, let's talk about vestibular syndrome. The reason I'm talking about this is because one of my favorite patients in the whole land, Thor, who is a very old, how old is Thor? 14 now, 13. He's an old little Chihuahua who is every bit of what you picture when you think of an old, hilarious Chihuahua. Thor is one of my super senior patients. His mom messaged me the last couple of days and said, "Oh no, we're in the ER. Thor is acting really weird. Sounds like I think he's having a stroke." And so she described to me what's going on. She was sitting at Veterinary Emergency Group in Franklin. And I said, sounds like he has vestibular syndrome. Take a deep breath. Everything's probably going to be okay. So that turns out that is what was wrong with Thor. And this is a common thing that happens in older dogs. So it can happen in any dogs and it can happen in cats as well. So that's why I want to talk about it, because this is a very common conversation I have. Clients will call. I would say vestibular syndrome is probably one of the most dramatic diagnoses that we see. So dramatic presentations. A dog comes in, owners are crying, they're devastated. They think their dog is dying. They think their dog has had a major stroke. I can't tell you how many times I calm an owner down and explain to them, this looks to be vestibular syndrome, and there's a good chance it's idiopathic, meaning it's not because of anything major and serious, and it's going to get better in a few days. So many times owners are relieved and emotional because they really thought their dog was dying. And here's why they thought their dog was dying. Vestibular syndrome can be very, very scary. So what is it? So dogs and cats have a vestibular system, and it involves their inner ear as well as part of their brain. So we call that their peripheral vestibular system and then their central vestibular system. And those two portions of the system sort of work together to give them their sense of equilibrium. They work together, the brain and the inner ear work together to sense the way the head is moving. And so all the things that are involved in doing that and keeping your world straight up and down is the vestibular system. In humans, if you want to relate this to things you think about in humans, vertigo is a similar condition in humans where if you've ever experienced vertigo, your equilibrium is off. So basically your inner ear, that system is not communicating well with your brain. And so nobody really knows where they are, and it can feel like up is down and down is up. And so that's kind of what the vestibular system does, keeps you in equilibrium. And so in dogs, they will develop vestibular syndrome where that's not working. And that's not working usually because of either an issue in the central part of the system or the peripheral part of the system. And what's more common is the peripheral part of the system. So because that is the inner ear, that can be caused by actual physical problems there. So they can have inner ear or outer ear infections that go into the inner ear. And so that infection can cause this loss of equilibrium and vestibular syndrome. Polyps or tumors in that area, so tissue that grows there that shouldn't be there, can also cause that. And then in the central area of the system, in the brain, obviously, brain lesions like tumors or other diseases in the brain, inflammation can cause this. So peripheral is more common, and what's most common is, especially in older dogs, we see idiopathic vestibular syndrome. And if I haven't taught you the word idiopathic yet, this is vet school for pet parents. Idiopathic means we don't really ever know why it happens. It just happens. And that's really common in dogs with vestibular syndrome. So there are lots of cases where it's not because of an ear infection. It's not because of a tumor in the ear or the brain. It just happens. Their equilibrium is off. So here's what it looks like it can happen very suddenly. You may wake up one day and your dog seems to be really dizzy. They can be falling over. They can have what's called nystagmus, where their eyes will move in an abnormal pattern. We generally classify that. That's called nystagmus. We classify it as far as which way the eyes are going. So the abnormal movement is called nystagmus. And then we, as their veterinarians, will look at that movement and decide, is it horizontal? Are the eyes going side to side? Is it vertical? Are they going up and down? Or is it rotary, which means they're sort of turning a little bit one way or the other? And the most concerning of those three is vertical nystagmus. So if the eyes are going up and down, that can indicate a more likely central lesion. So this is happening because of something in the brain. So like I said, they can be falling over. That's because they're ataxic. We call that ataxia, that wobbliness where they just can't really stand right. They can have a head tilt. So they'll often have their head tilting to one side. They can also often be circling. So if they can get up and walk, they'll tend to circle or turn to one side. They'll be a little Zoolander, if you will. But often they also can't stay up. So they'll kind of turn to one side and fall. They can vomit. They often don't want to eat, and they may drool because they are nauseated, because they basically feel car sick at all times. It's quite miserable if you're a human who's ever experienced vertigo, have Meniere's. It's really uncomfortable. And for our dogs, it's also very confusing. They don't understand why that's happening. We can't explain to them, hey, you have vestibular syndrome. It's going to go away in a few days. They don't understand that. So they can experience a lot of anxiety and be stressed out. So it is very scary. And when you see this as a dog owner, some of you are going to see this in the future. I want you to remember listening to this. Take a deep breath. You're going to need to call your vet, of course, because other things can look like this. But there's a chance it's vestibular syndrome. And in many of those cases, it's going to get better. But you do need to go see your vet. Like I said, a lot of people come into us or they'll go to the emergency room and they think their dog has had a huge stroke. And strokes, like we think about in people, are actually very uncommon in dogs. A lot of that is because in humans, a stroke is where blood supply is blocked or cut off in a portion of the brain, or there's bleeding in the brain. And that just doesn't happen in dogs as often because they have different anatomy and they're not as prone to things that lead to that in humans. It can happen, but a stroke like we think about in humans is actually pretty rare in dogs. So remember that as well. The way we treat this, when we see a dog with vestibular syndrome, we're going to talk about, hey, usually a vet's going to quickly say, this looks like vestibular syndrome. If they're seeing neurologic signs that are more severe than a typical vestibular syndrome, and they see that vertical nystagmus, they may be more concerned about a central brain lesion. They may talk to you about going to a neurologist for a workup, MRI of the brain, potential spinal tap. Those are the more serious cases, but in most cases, we suspect it's peripheral, often idiopathic. You're going to want a vet to do a good ear exam, make sure they don't see any signs of an ear infection. They're going to want to get a good history from you, make sure your dog hasn't had an outer ear infection lately, especially if you're at the ER and they don't know your history. They're going to want to, again, make sure they don't see any abnormal tissue, polyps, anything like that. And they're probably going to recommend blood work, as they should, and make sure they don't see any abnormalities that are major there. And so if all of those things sort of check out, no signs of ear infection, if they suspect an ear infection, they're going to treat that. We're going to basically support vestibular syndrome with just supportive care. So if they haven't been eating, if they seem dehydrated, maybe from vomiting, drooling, not eating, not drinking, they may get some IV fluid support. We typically will give them Cerenia, which is an antiemetic, so that's for vomiting. I'll give Cerenia as well as an anti-nausea medication I usually use ondansetron, which is Zofran. We can send that home if dogs can take things orally. A lot of veterinarians will tell you to give meclizine, which is what's in Dramamine. So it's an antihistamine, but it helps with nausea in people. I read about a study that interestingly really doesn't show that meclizine helps a lot. It certainly probably doesn't hurt, and so a lot of vets will still use it, and I think it's fine to try. And then again, any supportive care they need over the next few days. We want them to eat if they can. We want them to be comfortable. Sometimes if they're very anxious, I'll also put them on like trazodone or something else to keep them calm. And usually in 7 to 14 days, dogs with idiopathic vestibular syndrome are going to get better. I do see dogs, especially older dogs sometimes, who will have a head tilt long term after they've had vestibular syndrome. But usually that doesn't affect their quality of life long term. I do warn owners that once a dog has had vestibular syndrome, their likelihood of that happening again, I would say, is a little bit higher. And so we do talk about that and just what to look for. And we have a plan for managing it if it happens again. If it's happening a lot, again, we get more worried about a more central lesion going on. A lot of times owners just assume, oh, my old dog must have a brain tumor or a stroke because they're old. But we actually do see a lot of idiopathic vestibular syndrome in older dogs. And remember, idiopathic means it's just happening. We don't know why. It's going to get better. And it's usually peripheral. All right. Vestibular syndrome in dogs. I hope you learned something. Remember this. Some of you are going to have a dog with vestibular syndrome in the future, and it's going to really freak you out, but you're going to remember this episode of the Dr. Molly Says podcast, and you're going to have a plan. You're going to go to the vet. You're going to call your vet, or you're going to go to the ER if it's after hours. All right, we're going to do a dog, cat, dog sandwich today with our random cases. So our next case is a cat. I'm going to tell you about a cat. Oh, I told you, Thor was who had vestibular syndrome. I haven't talked to Thor's mom again, but I'm going to call her today. I haven't heard from her since he was at the ER. He did go to the clinic on Saturday to get blood work done to make sure everything was good, but I'm guessing he's doing better because I haven't heard from her, but I'm going to call her and check on him today. All right, our next case that I've seen recently that's interesting is a kitty cat. And I didn't ask this cat's owner for permission to give you his information, so I'm not going to tell you his real name, but I saw an older cat. We'll just call him Sid. I don't know why I picked Sid. We're going to call him Sid. Sid the cat. I saw Sid the cat last week. He's a cat who I have seen recently for just some checkup things. Mom called. She said, Sid is acting really weird. I think he may be blind. So we were like, come right in. So she came in for an appointment with me. So I looked at Sid in the room. Physically, other than his eyes, we'll get to that in a second, he looked pretty much the same as he did the last time I'd seen him, just a couple of weeks ago. So he's an older cat. He's a little bit thin, but physically everything looked like it did. No changes. So did that part of his exam. He was looking around in the room. I put him on the ground. He was able to walk around the room and navigate his way around. He did have some signs of being able to see. He had a menace response. So when I held my hand close to his eye, he would blink so he could at least acknowledge that that was there. I did an ocular exam. So I shone a light in his eye. I looked at what his pupils were doing. And so he definitely, when we look in the eye, we shine a light directly onto the eye and we want to see what the pupil does. So we want that pupil to constrict in response to the light coming in. So they're not getting too much light into the back of their eye. And that's called a PLR, a pupillary light reflex, when we do that. And he had that, which is good. We want them to. That's a sign that neurologic function is there and the eye is working to a certain degree, but it was not as strong as I would want. So it wasn't constricting as much as I want it to. And then I don't have all the tools to do a very good exam of the back of the eye. So what's called a fundic exam. So I wasn't really able to do a thorough fundic exam in this kitty cat, but I could see with my just regular ophthalmoscope what did the back of his eye look like. I can see any major like retinal hemorrhage, any obvious changes there, and I didn't see that. And the reason I was worried about that is because in cats, they can develop sudden blindness because of retinal issues. And that is often because of high blood pressure. And cats can have high blood pressure for different reasons, but we definitely worry about kidney disease in cats. Now, this cat, Sid, I had recently run blood work on for just a check-in, and his kidney values were normal just a few weeks ago. So we did rerun blood work just to make sure there were no changes there. And I did get blood pressure readings. And interestingly, his blood pressure was pretty normal. So his mean blood pressure was, I think, like, if I remember correctly, like 110, 115, which is pretty normal for a cat in the vet clinic. So wasn't really a dangerously high level. And I didn't see any major changes in the back of his eye. But I talked to Mom and I'm like, I agree with you, because he could see some, but we could just tell his pupils were too dilated. He wasn't responding to light, and the way he should. And what she was describing at home was consistent with a change in vision. So I told Mom, hey, I agree with you. I do think he's got a change in his vision. I don't have the tools to fully examine what's going on in his eye, and he doesn't have changes on blood work. His kidney values are still normal, and he doesn't have high blood pressure like I would expect in a lot of cats who suddenly have vision changes. So I recommended to her that she at least go to my friends at the eye vets in Nashville. If you remember, Dr. Ben Bergstrom, the ophthalmologist, owns a clinic here locally. I said, I think you should go to the eye vets. I think you need to have an ophthalmologist look at him, because they're the experts on the eyes, and I really want them to weigh in on this case, because I do think his eyes are his problem. He hadn't been like eating as well and just sort of reclused and not acting normally, and we're about to find out why. So Mom is great. She said, yep, let's do that. So the eye vets, they're so wonderful. They got him in the same day. So we called them. They said, yep, we'll see him. We can work him in at 1:00 this afternoon. So he went and saw Dr. Waller there, and she is so smart and awesome because she's an ophthalmologist, but she looked at the back of his eye, and when she looked at his retina, she noticed some changes that are consistent with a condition called histoplasmosis. And anybody in veterinary medicine who's listening to this is going to be like, oh, cool case. So, so I'm going to skip to the answer. So Sid was tested for histoplasma, which is a fungal infection. That pathogen is called Histoplasma capsulatum. Is that how I say it? Capsulatum. But histoplasma is a fungus that is usually soil is contaminated with histo from droppings from birds or bats that carry it. It's especially prevalent in the Mississippi and Ohio River valleys, and cats will inhale those spores. So that's how they get infected, and those fungal spores can go different places, but they often go to the central nervous system, and they can affect the eyes. So Sid was tested for histoplasma because Dr. Waller is so smart and suspected it, and that testing confirmed that he was infected with histo. So he had retinal swelling and partial blindness because of it. Cats can also have respiratory symptoms, so they can have nasal discharge, coughing, which he didn't have. They can have other neurologic signs. So if their central nervous system is more involved, they can have seizures, ataxia, like we just talked about, and different neurologic things. They can have disseminated cases of histoplasma where it just kind of goes everywhere. It gets in their GI system. They get really, really sick, and they can have enlarged lymph nodes. So those are the typical signs of histoplasma. Testing can be done with their blood and urine, I believe. And it can be diagnosed from cytologies, so little aspirates of their lymph nodes, or biopsies from lesions. And sometimes they can have spread into lung tissue, and so x-rays of their chest can show that. So Sid really just had this affecting his eyes. So he is now on an antifungal medication, which is the treatment of choice for histo. And as far as I know, I'm calling Mom to check on him today. He is doing well, and sometimes they will get steroids for the inflammation in their eyes to help with vision, but they can regain their vision. That it can get better, and we can treat these patients with histoplasmosis. Treatment can take a long time. It can be months that they're on these antifungal medications. If you didn't know, antifungals can be hard on the renal system, different organ systems, kidneys we really pay attention to, and liver when patients are on antifungals for a while. So Sid's going to be on antifungal exams for a while. But we're all rooting for him. We're hoping that his vision comes back and is normal again and that he is feeling better soon. So I just wanted to share that interesting case with you. I know y'all think I don't talk about cats a lot, but histoplasmosis in a cat causing vision changes only and some lethargy, but interesting case. All right. Third topic today. Is one of my most favorite things to talk about, and it's so random. The reason I'm talking about it is because I've had a lot of cases of this lately. One of my favorite patients, who is a very famous golden retriever, one of the cutest dogs on the internet. Her name is Pearl, the golden girl. She's a golden retriever who is my patient, and we love Pearl. We protect Pearl at all costs, and she's the sweetest, best golden. But Pearl had a lady part problem. She doesn't anymore because I fixed her. But we're about to make some content about this, so be looking for that. But Pearl's case, just thinking about making that content, reminded me we need to talk about this here. So we're going to talk about hooded vulvas. And I don't need an outline for this because I could talk about this all day. But female dogs have this issue. A lot of female dogs that I see have this issue. I think some of that is because I see a lot of poodle mixes, big doodly dogs. They seem to be more prone to this. They can have what's called a recessed vulva. So we're about to get graphic for a second, okay? So female dogs, when you look at their hind end, so if you lift their tail, you see their anus, and then under that, you should see a female dog's vulva, okay? You should see it. Her lady bit should be there for you to see. But in a lot of dogs, you can't see it. And a lot of times that's because their anatomy is not correct. I see this, like I said, a lot in doodles and poodle mixes. We see this a lot in pitties, actually. I see a lot of pitties with hooded vulvas. But any dog can have this. Frenchies, I see a lot of Frenchies with hooded vulvas, bulldogs. So what happens is, for one of two reasons, you can't see their vulva. And that's either because they just have a lot of excessive skin that's causing a hood over their vulva, so it's covering the vulva, or they have a really recessed vulva, or a combination of the two, where the vulva is just set too far in at the wrong angle, and so that just creates a hood of tissue over it. And the reason why this is a problem is because the vulva is where urine comes out. So their vagina and their urethra both exit there at the vulva. And so their urine comes out there, and there is a vault, so just kind of like an empty space where if it is recessed and there is tissue there, urine can get trapped there. So when they pee, urine is trapped there. That's irritating. And so that causes inflammation. A lot of these female dogs will lick or scoot there because it's irritated, right? And licking there and having chronic moisture and irritation there sets these dogs up for infection. So they can get infection at the vulva, at that site, and then that infection can go up into their urethra and into their bladder. And a lot of these dogs will have chronic or repetitive urinary tract infections. And I actually see a lot of these dogs sort of as second opinions, or I see a dog who's had a bunch of urinary tract infections even as a young female dog, or I see dogs who have been scooting for a long time, for years even, and their owners think they have anal gland problems. So they keep bringing them to the vet, they're getting their anal glands expressed, and it's not stopping the scooting. And they think they're scooting their butt, but they're really scooting because their vulva is irritated. And I find that can be missed. And so It's a rewarding second opinion that I see a good bit, where I get to say, I think it's been the vulva the whole time. And the reason I get excited to see these cases is because I can fix it, which is my favorite thing, when I can fix something. And so what I tell owners is, especially if we've had repeated urinary tract infections, they have a hooded vulva, I can visually see that. I can see under that extra tissue that there is hyperpigmentation. So there's basically chronic dark staining around that area because of chronic inflammation. There's redness and inflammation. A lot of times there will be actual discharge, buildup of discharge because of these chronic irritated bouts of irritation, and infection. There's white blood cells there. There's inflammatory cells there. Their skin will often be, a lot darker there than the rest of their skin because of all of that irritation. And that was the case with Pearl. So she had been having some urinary tract infections. She had been scooting and licking and irritated. And she had one of the worst hooded vulvas I've ever seen. So really recessed vulva, a lot of extra tissue there. We would actually have to lift a flap of tissue to get to her vulva to clean it out for surgery. So the treatment of choice for these dogs, especially when they've had these clinical issues, is to do surgery to fix their hooded vulva. It's one of my favorite surgeries to do because, like I said, I can fix it. It's like instant gratification. I do a short surgery that I have gotten very good at because I do it a lot, and a little nip tuck. We literally cut away that extra tissue. So I make an incision. We call it an elliptical incision. So I plan it so that it's a kind of a half moon shape of that extra tissue and kind of go up above from one side of the vulva to the other. And I cut that tissue away in a very specific shape so that I can close it and make it anatomically correct. And then I close that incision that I've made, which will remove that extra tissue, pull the tissue around the vulva up and together with the rest of the skin so that the vulva looks like it should and it can see the light of day again. So like I said, it's a short, pretty straightforward surgery. I find that a lot of veterinarians don't do this surgery regularly. And so a lot of vets are not necessarily general practice vets comfortable doing it. So come see me and I will fix your dog's vulva. No, there are plenty of vets out there that do it, but it's the recovery from that surgery is pretty straightforward as long as everything goes okay while they're under anesthesia. They do have a lot of stitches back there. It's a very sensitive area. I always laser that area. I put in local blocks to make them comfortable. They go home with pain medications, anti-inflammatories. I do often send these dogs home with antibiotics because they've had some level of infection in the skin there for a while. So I do that to treat that skin infection. We'll do cytologies to confirm that before surgery. And then we keep them on those antibiotics while we heal just to make sure we do heal. It's really important that these dogs stay in a cone while they're healing because that area gets really itchy and they want to lick and chew it. But once that incision heals, those stitches come out, that's it. We fixed it. That's all we have to do. They are very rewarding cases. Sometimes it fixes a years-long problem in these dogs. So if you are a dog owner with a female dog who's had chronic urinary tract infections or irritation back there under their tail and you're not exactly sure why, and you're kind of scratching your head, it's been frustrating, can't figure out what's going on, make sure your vet is doing an exam and looking at their vulva and make sure it's not hooded. I do want to also say there are plenty of dogs out there who have some level of a hooded vulva and they don't have issues because of it. And I don't go cutting these dogs if they're not having an issue. So if it's not broken, don't fix it, right? But in cases where we are having urinary tract infections, we do have irritation, we're licking, we're scooting, or we have infection there that's chronic or has happened multiple times, we're going to fix those vulvas. So if you go to my Instagram, I post about this. I have a few cases posted where you can see before and afters, and be on the lookout because Pearl, the golden girl, and I are working on some content right now to share about her case. Like I said, it's, I think, the worst I've ever seen. So it's a really good one to see her before and afters. She's a couple months post-op and she's doing great. We definitely fixed her problem. And she just got a new sister puppy at her house. I'm very excited about that. So I hope that was helpful too. And you'll remember this. I actually had an ER vet message me a few weeks ago and was like, Dr. Molly, I had a client come in tonight with a dog, and I went to talk to her about her dog having a hooded vulva, and she knew all about it because she told me she follows you. And I was like, my work here is done. This is all I want out of Dr. Molly Says. So I hope this happens again. So if you're a veterinarian listening, you may have a client ask you if their dog's vulva is hooded. And if you are a pet owner and you have these issues in your dog, feel free to ask your vet, do they happen to have a hooded vulva? Okay, this is a very random episode, but I think all three very interesting things. I hope it was helpful. This has been another episode of the Dr. Molly Says podcast. You can find us on Instagram and TikTok, Dr. Molly Says Pod. You can find me on Instagram, TikTok, Threads, and Facebook, Dr. Molly Says. Be sure to subscribe to our podcasts. Make sure you're downloading our episodes. Leave us a review if you want. And we are also on YouTube, so you can watch all of our episodes as well. I will see you next time on the Dr. Molly Says podcast.